Ventilator alarm is not a noise. As an ICU nurse, you must know about ventilator silence or ventilator alarms. High pressure alarm means increased airway pressure, cause kinking of tubing, secretion, patient coughing or biting the ET tube. Nursing action, checking the tubing, suctioning if needed, repositioning of patient. Low pressure alarm means air leak, cause disconnecting of circuit, ET tube cuff leaking, patient self-extubation. Nursing action, reconnect the circuit, check the cuff pressure, call the doctor immediately. Apnea alarm means patient is not breathing. Action to be taken, check the patient first. Start the manual ventilation. Inform the doctor urgently. Always remember the patient first pacing sound. This rule